Hello, I'm Dr. Sreekumar, oral and maxillofacial surgeon. In my line of work, a lot of patients come to me for correction of marks of the face, scars, and other facial problems for which they want a solution. It is very understandable because the face is an important aspect of our personality which will keep us very confident, and it also helps us to express ourselves and effectively communicate with each other. So when it comes to corrective procedures of the face, let's take a simple thing as a mark or a scar. Luckily, a vast majority of these problems can be corrected non-surgically, which means that it can be corrected either by injections, ointments, gels, and in those lines. For example, I would say, suppose if there is a scar that is there, and many a time it can become larger in size. We call that hypertrophic scarring, for which very effective solutions are possible by injections, which can be given into that region where the scar is, and that will allow the problem to settle down. Then a small majority of the scars and other marks fall into the category where a non-surgical solution is not possible. For these kind of situations, there are very precise and planned surgeries with which we can completely remove the scar tissue, and the surgical line can be very precisely hidden into the skin folds and areas which cannot be seen. Then there is another category, a very small percentage of situations where the problem is at a larger scale. For example, if there is a burn uh, victim or a person who's had burns where a lot of his or her skin is scarred, in these kind of situations, currently the trend, which has been a very groundbreaking technology, is what is called as tissue expanders. This is a very simple and very precise device which is placed near the scar tissue on the normal tissue area, and it is slowly inflated to cause an expansion of the tissue near the scar. So what happens is finally there will be an excess of tissue which can be used to cover the scar tissue once the scar tissue is removed. So now you will ask me, what causes these problems? I can broadly classify these into the following. One can be birth defects, the ones that the person are born with. Second, it can be after an accident. Third, it can be uh, after a surgical procedure, the related scar tissue and the like. And fourth, it can be because of a disease of the jaw bones or the structures around it. So currently, all these procedures or most of these procedures are planned by approaches uh, that are not on the face. What I mean by this is none of the surgical lines or the cuts for the surgery are placed on the face. These are very precisely or planned in such a way that these can be hidden inside, for example, the hairline. Uh, Most of the approaches are done through the mouth or in the neck line or the creases of the skin, which will not leave any scar post surgery. Other than these, there are also other defects of the face, like deformities, or I would say deficiencies or excess of the jaw bones, which also can be corrected by corrective jaw surgery. And most of these surgeries, or I would say all of these surgeries, are done inside the mouth. So the biggest advantage of doing this process through the mouth is that there will be no scar tissue on your face or the skin, yet you will get the desired uh, appearance of your face. So I think I have touched the tip of the iceberg, and I'm sure you will have a lot of questions, and feel free to contact me and I will answer all your queries. Thank you so much.